I am Sahar Al Noubani. I'm presenting today about support and needs of families of children with Down syndrome in Jordan. Down syndrome is the most common chromosomal disorder in pediatrics. Each year, about 1 in 700 babies are born with Down syndrome, although we don't have an estimate in Jordan. Children with Down syndrome may have a large variety of health problems with varying severity, such as delayed motor, functional, and cognitive performance, which require complex healthcare needs. Children with Down syndrome can live healthy and fulfilling lives if they get the proper healthcare and meet their needs. And after reviewing the literature, we found that children with Down syndrome needs include educational support, community programming, friendship opportunities, while family needs of children with Down syndrome include need for information, communication, social and financial support, and need for special education services provided for their children. Therefore, understanding the needs of families of children with Down syndrome and their support networks is important to provide quality healthcare services. The significance of this study. This study will provide information about support and needs, and it will address the lack of the studies that examine the child age and gender. We have three aims for this study. The first aim is to describe the support and needs of families of children with Down syndrome. The second aim is to compare between the support and needs of families of children with Down syndrome and typically developed children. For the last aim is to examine the effect of children's age and gender on the support and needs of families. About the research design, we used a cross-sectional descriptive study. This study was approved by the Institutional Review Board Committee and the Deanship of Graduate Studies at the University of Jordan. All participants provided informed consent before participating in the study. Participants. Data were collected from a convenience sample of 62 parents of children with Down syndrome and 62 parents of typically developed children. The children aged between 1 month to 12 years. We divided the children to two groups. The first group is from 1 month to 6 years, and the second group is from 7 years to 12 years. The number of children with Down syndrome was 36 from 1 month to 6 years and 26 from 7 years to 12 years. And for typically developed children, from 1 month to 6 years, there were 33, and from 7 years to 12 years, there were 29 children. About the outcome measures, we used two valid and reliable tools for this study. The first one is Arabic Family Needs Scale. It measures a family's need for different kinds of resources and support. Arabic version of the scale includes 41 items organized into 9 categories of needs. Each item is rated on a 5-point scale ranging from not applicable to almost always. The second outcome measure is Arabic Family Support Scale. This scale includes 18 items. Each item is rated on a 5-point scale ranging from not available to extremely helpful. Procedure. Parents were recruited from private centers via face to face interviews, and parents who are not seeking medical services for their children through snowball samples located in 6 different governorators via Zoom calls. We have recruited parents of typically developed children from siblings or cousins of children with Down syndrome who were recruited in this study if available. And if not, we have recruited children with the same age and almost the same financial and social conditions as typically developed children to compare the two groups. The interviewed parents completed the family needs scale and the family support scale. Data collection occurred over 3 months, from February to May 2021. Each interview lasted in average from 20 to 30 minutes. Results. For the first aim, we used descriptive analysis. We found that spouse and partner support have the highest percentage, while program organizations have the lowest. In the family needs scale, we found that future concerns have the highest percentage, while basic resources have the lowest. For the second aim, we used t-test analysis. We found that all the family support skills, subskills, and total score were significantly different for the groups, except for the kinship support and the total score of formal support. For family needs scale, we found that all the family needs scale, subskills, and total scores were significantly different between the two groups. For the last aim, we found that child age groups have not significantly different between the two groups, except for family support scale program organization and formal support and family needs scale financial subskills. And for the child gender between male and female, we found that there was not significantly difference between male and female except for family support skills, spouse and partner support, and informal support. Discussion. In family support skills, spouse and partner support have the highest percentage, while program organization have the lowest. That may due to the lack of association and schools that accept children with Down syndrome in Jordan. In family needs scale, future concerns have the highest percentage while basic resources have the lowest. That may because parents are worried about their children's future due to the lack of organizational support for children with Down syndrome in Jordan. There were significant differences in family support and needs between families of children with Down syndrome and typically developed children, except for the kinship support and formal support, indicating that kinship support and formal support were the same in both groups. There is a high needs for children with Down syndrome compared to typically developed children. That's made due to the huge costs of the medical and rehabilitation services that children with Down syndrome need in Jordan, with no insurance covers the treatment costs. Children less than 6 years demonstrate higher needs than older age. That may be because children with younger age might have highest need of rehabilitation and medical care. There was no difference in family needs by gender. This indicates that we don't have gender bias in our community. Limitation of this study. The first limitation is only parents report the data and thus that may not accurately reflect the practice. So we should also collect the data from healthcare providers and school administrators. The second limitation is that participation of parents of children with Down syndrome was obtained only through private centers located in 6 different governorates in Jordan. Therefore, we didn't include the public centers. The last limitation is that face to face interviews were constructed due to COVID 19. Therefore, face to face and Zoom calls were conducted from survey purposes. Recommendation. It is expected to provide health professionals with evidence to advocate and improving the health services provided to the children with Down syndrome. The second recommendation is to assist setting comprehensive healthcare plans to fulfill the different type of needs of children and their families. The third one is allocating the limited resources available in the community to meet the individual needs of children with Down syndrome to enhance their participation and quality of life. Knowing the needs of families of children with Down syndrome in Jordan should provide health professionals in planning multidisciplinary team, multidisciplinary services. Thank you.